Okay, Andrea Sotia. Hello, Dr. Kaya. Can you explain high prolactin levels and what it means to indicate a pituitary adenoma, benign tumor? What are the risks and what is the treatment? Okay, the treatment can be high prolactin levels. Prolactin is a hormone, again, it makes you make breast milk, amongst other things. That's usually not the only hormone. Your pituitary gland secretes a variety of different hormones, and it controls a variety of different neurohormonal functions. So when you get high prolactin levels, that's telling you something is going on. You can usually now get a CT scan and or an MRI, and it will tell you that you have an adenoma in your pituitary gland. You can remove that, and the usual technique now is to literally go up through your nose, because the pituitary gland is literally located straight between your eyes, about 2 inches in. They can go in, puncture the roof of your mouth, take that pituitary gland out, sometimes just the adenoma, sometimes the entire pituitary gland. That means, however, that you're going to have to be on regulatory and replacement hormone therapy for the remainder of your life. There will not be a time that you could come out and you remove the entire pituitary gland. If they are fortunate enough to get, because now some of the technology that's available allows a micromillimeter to micromillimeter surgical capacity. So they can actually just remove the benign tumor portion and leave functioning pituitary gland in there if it has not been destroyed. Because two things cannot occupy the same space at the same time. In your skull, there's a thing called a pituitary fossa, which holds the pituitary gland, which is about the size of a single green pea. And it looks like a green pea hanging on a stalk that fits down in that fossa. But if you get a benign growth that's pushing it out of the way, just the growth and maturity of that tumor starts to destroy pituitary tissue per se, and you might not have enough functioning pituitary gland left. So, because oftentimes people will go an extraordinary period of time not even aware that they're having this, they're not having any symptoms until they do. So, this is one of the things that, again, it requires a partnership between you, your endocrinologist, your primary care provider, which would be an internist or a family physician, and again, those three people, part of your life from now on, to optimize and replacement of those variants and controlling that neurohormonal function that is traditionally done by the pituitary gland. So I have patients that have had the procedure. Most of them do quite well. I've got a few that have had complications, but the earlier you get it done, the better you will usually do. So that will be the way. So that's what the risks and those are what the treatments are. But again, sometimes you can do what's called watchful waiting, and you just monitor the hormonal status. You correct, adjust, do those things that you can do to keep your hormones within normal levels. But over time, it usually gets bigger and gets worse. So if you can intervene early by fixing the problem versus controlling the symptoms, that is the option that I would recommend. Great question, Andrew. Okay.